Reclassification of abortion-inducing drugs in Louisiana, a comprehensive analysis. Louisiana's legislature has passed a groundbreaking bill that seeks to reclassify Mifepristone and Misoprostol, commonly known as abortion pills, as controlled and dangerous substances. This move, if signed into law by Governor Jeff Landry, would mark a significant shift in the state's approach to reproductive healthcare and could have far-reaching implications for access to abortion services nationwide. Supporters' perspective: protecting expectant mothers. Proponents of the reclassification argue that it is necessary to safeguard expectant mothers from coerced abortions. They maintain that placing Mifepristone and Misoprostol on the Schedule IV drug list under the state's Uniform Controlled Dangerous Substances Law would make it more difficult for unauthorized individuals to obtain these medications and prevent their potential misuse. Concerns raised by medical professionals. Numerous medical professionals, however, have expressed concerns that the bill would create unnecessary barriers to accessing these drugs, which are also used for a range of other essential reproductive healthcare needs, including treating miscarriages, inducing labor, and stopping hemorrhaging. They argue that any delay in obtaining these medications could have negative consequences for patients, particularly in a state with one of the highest maternal mortality rates in the country. Potential impact on access to abortion. Louisiana's existing near-total abortion ban already prohibits both surgical and medical abortions, including those induced by Mifepristone and Misoprostol. However, the reclassification of these drugs could further complicate access to abortion services and could potentially open the door for other Republican-led states with abortion bans to impose similar restrictions on the drugs. Federal regulations and classification. At the federal level, Mifepristone and Misoprostol are not classified as controlled substances by the Food and Drug Administration, FDA, which has deemed them safe and effective for ending early pregnancies. The FDA has specifically approved Mifepristone for this purpose since 2000 and Misoprostol for treating stomach ulcers. Political divide and legal challenges. The Louisiana bill has drawn both support from abortion opponents and conservative Republicans and strong criticism from Democrats and reproductive rights advocates. Vice President Kamala Harris has condemned the bill as unconscionable. The U.S. Supreme Court recently heard arguments in a case involving doctors who seek to restrict access to Mifepristone, but the justices did not indicate a willingness to limit access to the drug. Outlook and potential consequences. Governor Landry, a conservative Republican, has indicated his support for the bill. If signed into law, the measure is expected to face legal challenges from opponents who argue that it violates federal law and constitutional protections for reproductive choice. The reclassification of Mifepristone and Misoprostol in Louisiana would have significant implications for access to abortion and reproductive healthcare services in the state and could potentially set a precedent for other states to enact similar restrictions. The outcome of legal challenges to the bill and the ongoing national debate on abortion rights will shape the future of reproductive healthcare in Louisiana and the United States as a whole.